issues is that they didn't protect us from the beginning.
As Arizona starts to reopen, workers on the front lines have fallen ill.
We're not essential, we're sacrificial.
Facing the virus head-on for months.
I'm one of the people that almost died.
Why don't we have masks? We need something to protect us.
Do you feel safe at work?
No.
Now, Arizonans are starting to go back to work, bars, theaters, gyms, and school.
We need school!
But these essential workers never stayed home.
We need to step up and they need to protect our staff and our patients.
This is everything you need to know about essential workers.
That I have to choose my job or my life.
I'm Katie Wilcox, the executive producer for our I-Team, and joining me is I-Team reporter Bianca Bono. So Bianca, let's just start out this conversation talking about what does it mean to be an essential worker?
Yeah, so I think when you think about a global pandemic and who would be essential, there are some people that come to mind right away. You know, doctors, nurses, ambulance drivers, police officers, firefighters, but there are also so many on this list that are less talked about. We have bus drivers, garbage collectors, court personnel, the media, and grocery store workers. So the list is pretty extensive.
Where does that list actually come from? What makes a job essential?
So it actually comes down from the governor. Back in March, when the pandemic was really starting to ramp up, the governor actually issued an executive order completely devoted to this topic of essential workers and laid out exactly who would qualify. And some of Governor Doug Ducey's qualified essential workers were quite controversial, probably the most being hairdressers.
They're just trying to pay their bills. They're following Ducey's order, but it's an irresponsible order.
A new executive order details a long list of essential services. People in these jobs would continue to do them if the states shut down. The list is 6 pages long.
I couldn't live with myself if I inadvertently played a role in passing a virus along.
Since that late March decision, we know that a lot has changed. Salons actually closed for a period of time, and then as of August 27th, more businesses in Phoenix were actually allowed to start reopening. So that's, the theaters, the bars, the gyms. But the frontline workers you're talking about, the garbage collectors, the bus drivers, of course, first responders, they've faced this virus head on for a long time. What challenges did those groups face?
Well, let's talk about firefighters and police, because I think they faced a really unique set of challenges right off the bat, which was, they're getting 911 calls throughout the day. So they're responding to homes all across the state, to all different kinds of people, and they're in very close proximity with these people, and they have no clue where the virus is. On top of that, we talked a lot about early on how the Phoenix Fire Department actually had a PPE shortage. So as they're responding to these types of calls, they didn't even feel like they could adequately protect themselves when doing so.
We have ordered millions of dollars worth of PPE, personal protection equipment, that keeps getting hijacked before it gets to the city of Phoenix.
Fire Chief Kara Kalkbrenner explaining why some Phoenix firefighters are wearing rain ponchos in place of protective gowns while responding to emergencies. This photo, recently posted online by a concerned citizen, shows 2 firefighters wearing the ponchos. Chief Kalkbrenner says the International Association of Fire Chiefs has determined the disposable ponchos are a reliable protection.
So right after that, the state acknowledged this was a real problem, borderline crisis. So the state actually created a special rule that would allow first responders to have access to a database that would at least give them an idea of where COVID-19 positive patients were. So if they got a 911 call from a home where there was a COVID-19 positive person, they would at least be able to prepare themselves and really PPE up, mask up, so they could give themselves the best chance from preventing themselves from catching the virus.
Over the summer, at least 100 firefighters had tested positive for the virus, and thankfully, as of last month, the department said that most of them had already recovered and come back to work. But during the month of just July, the department said it responded more than 1,500 COVID-19 calls. So when a firefighter and essential worker does get sick, what's supposed to happen? And, from your reporting, what actually does happen?
Well, what's supposed to happen is really what's supposed to happen for anyone who would contract the virus, which is to isolate themselves. But unfortunately, there's a real risk of a staff shortage. These first responders are arguably more important now than they ever have been. So, a lot of departments and employers are concerned that if there were to be an outbreak amongst employees, that there would be a staff shortage. And, in one case, it was a really egregious case out of Prescott at a nursing home called Granite Creek. We actually heard from employees who contacted us saying they tested positive for the virus, but they were told by their employer, if you're not symptomatic and if you're feeling okay, you still have to come to work.
I've been crying every other day because residents that I have taken care of for over 5 years are now dead.
Once that one person, the very first person came up positive, it just went like a wildfire.
My coworkers are in that building right now working with the COVID.
You also interviewed essential workers in behavioral health who said a lot of the same things, that the virus was spreading throughout their patients and apparently to some of the staff. What was that like?
Yeah, so what was uniquely troubling when it comes to behavioral health employers is that they were told they were not allowed to wear N95 masks to work. And the reason that was, according to Valleywise's health director who we interviewed, is that there is still a PPE shortage. You know, early on in this pandemic, we talked a lot about this shortage, and I think us in the media, and I'm sure many in the public, thought that crisis had been resolved. But unfortunately, as we're learning, as recently as a couple of weeks ago, it hasn't been. So yeah, behavioral health employees who were working with COVID positive patients were not allowed to wear N95 masks.
I was upset. All of my coworkers were upset. We would wear them and then we would get in trouble. We have to sneak them under surgical masks in order to protect ourselves. Why are you sending staff into the war zone, basically, without protection?
12 News taking that question and more to Dr. Michael White, Valleywise's Executive Vice President and Chief Medical Officer.
That surgical mask has been shown to decrease the risk of transmission of this virus.
White says it's a shortage problem. Hospital data shows Valleywise has enough N95 masks for the next 112 days. But that's just for medical staff working with the sickest COVID patients. For example, patients on ventilators. White says if that supply was extended to the behavioral health staff and others,
it would go from that 112 number to probably less than a week of supply on hand.
So again, even though these behavioral health workers were dealing with mentally ill people who have the coronavirus, because they're not in a hospital situation, they said we need to save these N95 masks for those who are the most severely sick with the coronavirus.
So we have this issue of the masks. We have this issue of people having to come back to work because of the shortage. Now there's a question of, are you going to get paid?
Absolutely. And something that was passed early on, I think it was April 1st, the government passed the Families First Coronavirus Response Act, which in theory was supposed to solve that problem. The issue is that there was an exception written into this bill that said first responders can be deemed exempt from this. And that's because, again, going back to the staffing shortage problem. So it was really up to each individual city and town to decide if they're going to cover first responders under this FFCRA. Well, what we learned is that the majority of, let's say, police departments, the majority of police departments in the Valley elected to cover police officers. However, we quickly learned that the Scottsdale Police Department was one major department that decided not to.
We just want the same support back, and it's something we're not getting from the city.
Damian Mendoza, president of the Police Officers of Scottsdale Association, says if a police employee or their family member were to contract the virus, the Scottsdale Police Department is not currently offering them emergency paid sick time.
I believe it's wrong that we don't have that as first responders. If someone doesn't have the bank sick time or vacation time, they would be essentially without pay. It's something that is provided to the rest of the employees in the city of Scottsdale. However, the emergency responders have been excluded from that.
And it actually took the department fighting and speaking out to the media in order to get that. And I'm happy to report that since our initial reporting on this, the Scottsdale City Council passed and is now paying 6 Scottsdale police officers, but it wasn't an easy fight for them to get that.
This is a big concern for the bus drivers. Tell us what's happening with the bus drivers.
Yeah, so early on, bus drivers were right off the bat deemed an essential worker. Many of these bus drivers are transporting other essential workers like grocery store employees or nurses or doctors to get to their jobs. So, of course, the buses had to run. And Mark Hell is the bus driver that has been telling us his story since early April. And early on, I think he identified that this was going to be a real problem for bus drivers long before many others saw it. And he actually started documenting how dirty buses were and how concerned he was about the environment on a bus, a lack of social distancing. And he sent us some of his early videos that just showed how problematic it really could be for bus drivers.
I just want to take a video to show you how nasty and filthy this bus is. If I get sick with the coronavirus, you're looking at the reason why.
When he took that video, it was almost like a prophecy, because by the time you and I actually talked to him in the first place, he had tested positive for the virus and was really worried about losing his job if he talked to us. But he laid out a number of questions right off from the beginning there. Specifically, what do essential workers like the bus drivers, what rights do they have to getting that paid leave?
Well, when it comes to bus drivers, it's actually a really tricky topic, because although buses are a city service, and many probably assume bus drivers are city employees, when we turned to the city of Phoenix, we actually found out they're not. So even though the city of Phoenix elected to give paid sick time to all of its employees, we learned that bus drivers actually work for third-party private companies. So it's up to each individual private company to decide what their policy is going to be for bus drivers, which can just become really confusing, and it's really down to a case-by-case basis.
Kicking my tail right now, and to tell you the truth, I'm not even sure I'm going to make it.
I'm scared every day.
Taylor's mom and sister now speaking out on his behalf because he has COVID-19 and has been in and out of the ICU at Banner Estrella.
The passengers, they love him. I wish his company did too.
His family says First Transit and the city of Phoenix have an opportunity to make things right.
Step up and do the right thing and take care of all city employees.
I think that Markell sort of became an advocate for other bus drivers too. And as the city started to reopen, more people started riding the bus. And that was great that we were seeing people starting to get back out there. But the problem is that once more people started riding the bus, they found that people weren't wearing masks on buses, and bus drivers really had no way of enforcing that mask mandate.
She asked, "Why are you the only bus driver that's saying anything about the face mask?" Her hand literally came around 3 times, bam, bam, right to the face.
Forsberg ending up with a broken nose.
Actually, the cut here and the cut here was from my sunglasses, and I was bleeding out both of my nostrils.
So not only are bus drivers now more concerned, they're also more susceptible to the virus. And unfortunately, we did see more bus drivers contract the coronavirus, and one unfortunately passed away.
We're not essential, we're sacrificial. It knocks you out and just catches your breath. And it's just instant. It hurts like hell.
My Black and brown people are dying more. So I am very serious about this. You're going to have more of us getting sick, period. Why would you let someone on a bus without a mask and not make it enforceable?
Yeah, I think the issue that Markell raises, and he's been raising from the get-go, is just a lack of consistency and clear policies. So, I think that all he really wants is just a safe work environment for himself and for his colleagues. He wants protection for workers if and when they do get sick, because they are essential workers and they are risking their health, their family's health, in order to keep the city moving. And yeah, just having a clear policy in place, especially when it comes to paid sick time. The last thing that you want is motivating employees to continue coming to work when they're sick.
And as we speak, we know that schools, theaters, bars, other businesses are opening back up. But we actually talked to some vital health essential workers who raised a red flag about the guidelines in their own department, that is ADHS.
They're providing the guidelines for reopening of all these different things, but they can't seem to get it together for their own agents.
Certainly, it's just very disturbing to hear that there are allegations within our own health department. But yeah, we've learned a lot over the past couple of months, certainly since March and even since June. Obviously, we've learned that masks are important. They make a huge difference. PPE makes a huge difference for these essential workers. These businesses are supposed to be at partial capacity, and obviously, as we're sitting here today talking, more businesses in the Valley are opening, so we're going to be watching very closely to see how it plays out. And, I think a lot of these essential workers are just hoping that we've learned from the last spike, right? The state now has a hotline where you can report businesses who are not following protocols, which I think is really important and something that's been lacking over the past few months. Employees have been forced to speak up against their own employers. So now there is a hotline where at least it can be reported. So we're hoping that we don't see more shutdowns, but investigators might be put in that position once again.
It feels good to start feeling like we're coming out of this pandemic, but with so many questions about exposure and, of course, pay, I know there's still a ton of stories to tell, and I really appreciate you and your reporting.
Thank you.